Hello, this is Dr. JoAnn Manson, professor of medicine at Harvard Medical School and Brigham Women's Hospital. I'd like to talk with you about a recent report in Circulation, Go Red for Women issue, that suggests that the postpartum period may be a critical window of opportunity for improving cardiovascular health among women with a hypertensive pregnancy, women with preeclampsia or gestational hypertension during a pregnancy. Now, this is a small randomized trial from the UK, but it may have a very big clinical message, especially in terms of proof of principle. So the trial is called POP-HT, or Physician Optimized Postpartum Hypertension Treatment. Include about 200 women, half randomized to improve blood pressure control, half to usual care after a hypertensive pregnancy. And the investigators had previously shown that the intervention did improve blood pressure control at 9 months. And the purpose of this study was to look at whether the improved blood pressure control could reverse some of the adverse cardiac remodeling that takes place during a hypertensive pregnancy. And so they did multimodality imaging, including transthoracic echo, as well as cardiac MRI, did the imaging at the end of the pregnancy, at the time of delivery, and then again 9 months postpartum. And what they found was that the women who were randomized to the intervention versus usual care did have more favorable results in terms of cardiac structure and function. They had less wall thickness, lower left ventricular mass, lower end diastolic and end systolic volumes, as well as better ejection fractions, higher ejection fractions. Now, whether these results will translate into lower risk of heart failure, HFrEF, HFpEF, also lower risk of coronary heart disease or stroke events, because women with these hypertensive pregnancies are at higher risk of these adverse cardiovascular events, will need to be determined with larger trials and longer-term follow-up. However, the study does suggest that the postpartum period is another critical window of opportunity for improving women's cardiovascular health. Previous studies have suggested that preconception and during pregnancy are critical periods, as well as the menopause transition and early postmenopause. I think this study suggests that the postpartum period is also a very important time frame for trying to optimize blood pressure control among women with hypertensive pregnancy. Thank you so much for your attention. This is JoAnn Manson.